We try to bring awareness to our community related to breast cancer. So we want to make it, all year round. We talk about breast cancer, but October is a special month to bring awareness. So we want to make it accessible to women. We want to educate our community about breast cancer and other women's issues. I'm a breast cancer survivor myself, so I'm very passionate about it, so I've been on both sides. My position allows me to look at the whole service line. So I'm able to influence our technology, primarily in imaging, and work closely with our radiologists and our surgeons to see what we can do to detect breast cancer sooner. So we brought in the tomosynthesis, or what we call 3D mammo. We're doing many more mammograms, and we're finding cancers sooner with using that technology. So that's one of the, I think, largest impacts I've been able to help direct.
What we're doing here is 3D mammography, also known as tomosynthesis. I'm reading screening mammograms now, so I'll have a pile of mammograms that I'll page through. With the 3D, it gives us an opportunity we more or less take slices through the breast, and then we can go through each individual slice, and we can see things generally a lot better than we could with the routine mammography, which we were doing for so long. We're looking for several things. A mass. We're looking for a mass. If you see a mass, that's a sign that it may be malignant, it may be benign. We look for characteristics that will help us decide that. Calcium deposits can be a sign of an early cancer, so we look for that as well. And we look for something else called architectural distortion, where there just might be something just a little off in the breast. It might be a little asymmetric, or it might have other characteristics that would make us think that it's something that we need to further evaluate. I know I've seen several cases where I know I would never have seen it on the routine 2D mammography.
So if you're trying to read a book and you hold the book up, you can't see through the book. But by using 3D, you're able to look at each individual page. So we're able to find smaller cancers sooner.
Any woman who has breast complaints such as a mass, breast pain, discharge from their nipple, I will see those patients, evaluate them, help them arrange for proper diagnostic testing. Sometimes I'll see a lady after she's had a screening mammogram that's been abnormal, and we provide a range of breast health care for the women. Early detection of breast cancer saves lives, and we can only do that with the education and cooperation of the patients who come and get the early detection. And that can be anything from a screening mammography to a clinical breast exam by your practitioner, your physician, your nurse practitioner or PA, and also self-breast exam. And so we think this is a very important time to bring this to the public awareness, because we really want women to take control of their health care. The outcomes for treating breast cancer have improved quite a bit in the past years, but not everybody knows that. So people will present when they have a diagnosis of a new cancer or a pre-cancer or even a lesion that's completely benign with a lot of stress, and that is completely understandable. And so part of what I try to do in my first visit is to give a holistic view of what the issue really is and what that represents to them short-term and long-term.
We decided to talk about breast cancer awareness, but also some of the other issues that women, particularly women, deal with. So what we did was a women speaker series every Wednesday in October. We have a radiologist at the site to kind of kick off the program to talk about breast cancer and mammography, the tomosynthesis, and then we also are introducing our new breast surgeon, Dr. Sharon Goldstein.
Which is terrific. I've been going to all of them. We've had talks on varicose veins, we're having a talk on menopause symptoms, polycystic ovarian disease, vascular disease, HPV, and there's a lot of good topics. We also have a nice little gift giveaway with some fun things and some nice food that's provided to us. And it's social. It's a very nice give and take sort of atmosphere. This is a more casual, and afterwards the patients can come up and just ask questions either about the topic of breast cancer or any general medical topic that particularly affects women.
One of our initiatives has always been breaking down barriers for women to get their mammogram. We have walk-in Wednesdays, so you can walk into any one of our facilities that offers 3D mammography and get your screening mammogram. If it's been a year since your last one, so any screening you can walk in. So it takes a half hour. So if you're shopping or running around and you say, boy, I need to get my mammogram, just walk in on a Wednesday. We'll get you in and out. The Pens are promoting our Text for Mammo campaign. So again, as we continue to use technology, we don't necessarily pick up the phone anymore, we pick up to text. You can text 24587 and we will text you back with some questions and we will set up an appointment for you that meets your schedule through texting. So you don't have to stop, you don't have to pick up the phone, you don't have to be put on hold, you can just text it, move on, we'll get right back to you and we'll set it up. But we have really high-end technology here. We have board-certified radiologists that are very compassionate and caring, and we have great surgeons here as well, and we have a community feel, and there's really no reason to leave our community. I think we do it better here. We have a joint venture with UPMC at the Arnold Palmer Cancer Center. So you can get radiation therapy if that's what you need. You can get chemotherapy if that's what you need. So you really do not need to leave. And when you're going through something like that, and I can speak to it personally because I had all my care here, and it'll be 7 years that I've been cancer free, and I was stage 3. So, you know, it happens. So what I would suggest to people is one of the most important things is to have support, and this community will support you. So to have to drive out of this community to get your care, it's just one more thing that you really don't need to deal with. So I highly recommend that people stay here because you will get a good outcome.